Hi, everyone. Thank you for joining today's session. My name is Ariel Sharf. I'm the Director of B2B at Vivian Health. And today we're going to be talking about a topic that is top of mind for most of you who are in HR leadership in healthcare, recruitment, at a time when so many clinicians are leaving their job in the healthcare industry. I'm going to start us off by introducing your main speaker for the day and sharing some findings from a survey that we conducted of 1,300 nurses about their career choices. Rashad Parmar, the head of strategy at Vivian Health, will walk through 3 critical new changes that you can implement in your recruitment process. As you watch this webinar, I encourage you to go to hire.vivian.com to learn more about how our transparent jobs marketplace for healthcare can help your organization meet its hiring goals and implement some of these recruitment changes during this really challenging time for hiring. So before we get started, I want to provide a quick overview for folks on Vivian Health. We are the largest online recruitment marketplace dedicated to healthcare clinicians, including nursing, allied health professionals, and advanced practice providers. We have a little bit over 300,000 clinicians in all 50 states utilize our platform, and we work with many different healthcare employers from acute care to health systems, sub and post-acute and ambulatory settings, home health agencies, and travel and permanent staffing, travel, per diem, and permanent staffing agencies. We're really happy to share our perspective on the recruitment best practices in this current environment. Some of this is things that we have already implemented for our clients, and others are just good practices that you can implement in-house. Now I'm going to tell you a little bit more about the environment that we are currently looking at. We did a pulse check on how our nurses who have been at the front lines battling the pandemic were feeling about the current working environment and what's next for them. We surveyed 1,300 nurses working in close to 1,000 hospitals. We tried to ensure that the survey was representative of the overall nurse population. So here's some detailed information to the right on our sample set, which points to a pretty balanced distribution of age, experience, and regions in the US. So we believe that these findings are pretty representative of not only the national feeling of nurses, but probably the nurses that work at your organization as well. Our nurses have gone through a lot in the last year and a half. I'm just going to let these stats start to speak for themselves. But we expected nurses to feel burnt out. That's normal based on what's happened in this past year, and that really aligns with some of the media coverage and probably the internal surveys you have been conducting at your organization. But even the findings of the survey were pretty shocking. 78% say their priorities for a job have changed over the last year. And that's really amazing. Like, we dig a little into that in the next slide, but one clue as to why that might be is that 36% of the nurses were extremely dissatisfied with their compensation during the COVID-19 crisis. We were also fairly shocked to learn that 43% of nurses are considering leaving the healthcare profession in 2021. This is number one red level crisis for this workforce. We've been talking about mental health and burnout for clinicians, for all types of clinicians, for decades now, but never have we had this cataclysmic event like COVID-19 that has really catalyzed all these people genuinely looking to leave the profession. To put this in some perspective, in a similar survey that we conducted in 2020, only 15 to 20% of those nurses were considering leaving. And those, so like, even if we say they're not leaving healthcare in particular, many are highly motivated to leave their existing jobs. So we know that regardless of what organization you work for, you're likely seeing higher turnover than you're used to. You're having to work doubly hard to get the same amount of recruits in. We know our typical turnover rate in the industry is 10%, but if even a quarter of these nurses who have indicated they're considering leaving the profession, if even a quarter of them leave, that is 400,000 nurses across the country leaving the profession. And when you think about the fact that we only add about 130,000 nurses every year, this shortage is going to be a huge shock to the industry. So with that being said, it's definitely time to pause and take stock of where we are now and how This could have a massive impact on healthcare delivery. I want to dig a little bit deeper into some of the figures that we just talked about. We also asked what was most important for the nurses in their job. Pay has jumped to the top priority for all nurses. So that's both permanent and travel. So perm staff saw their pay being cut, while travelers made 4 or 5 times their hourly rates doing about the same job. Along with pay and benefits, flexibility has become a lot more important as well. And there's probably a lot of factors that go into this. Our survey didn't dig deep enough to come to some solid conclusions, but we can guess that childcare is likely responsible for a big desire for flexible hours. We saw huge upheaval not only in the workforce for healthcare, but also in the childcare and schooling system in the US. And so not only are our nurses caring for COVID patients all day, but many are the primary childcare provider at home as well. So these things are really, really highly valued to the clinicians that are looking for new opportunities. And this is what they're thinking about as they're looking for their new opportunities. So what that means is it's really important to emphasize, how are you addressing this? What steps is your organization taking to make sure that your clinicians do have that kind of flexibility, despite having to show up and have a staffed department, staffed ICU, whatever department you might be in charge of, and making sure that's clear to the clinician that you're recruiting that they will have a better quality of life if they work for your organization. We see mental health services has also jumped up significantly from past surveys. So clinicians are looking for more support here from their employers. And what's notable is that it is mental health services specifically. It's not just the benefit of being able to have certain things covered, but I think what a lot of more frontline organizations have done is they've centralized this service so that this service is available within the four walls of the clinic or within the walls of the facility, the health system, as a resource for their employees. And so ultimately, the bottom line is that given the magnitude of the overall change, recruitment strategy for health systems needs a paradigm shift. Small incremental changes, adding a couple extra days of PTO, adding an employee appreciation party, they're not going to cut it to attract the kind of talent that you're going to need to staff your facilities at this time when so many talented individuals are looking outside of healthcare and definitely looking outside of their current jobs. So what you'll need radical changes to successfully recruit and retain talent going forward. So with that, I'm going to pass it over to Rashad Parmar. He's going to walk you through 3 of these changes that you can make.
Thank you, Ariel, for providing the context here. Yes, these survey findings, especially the number of nurses looking at leaving their current employers or leaving the profession altogether, are very concerning indeed. This potentially unprecedented staff turnover, combined with changing priorities for clinicians, poses a huge challenge for our health systems and overall healthcare delivery. And we believe small incremental efforts will just not help. Health systems today need a paradigm shift in both their recruitment as well as retention efforts. And the efforts need to start now. Today, we'll focus our discussion primarily around recruitment and talk about 3 radical recruitment strategies that health systems can deploy to address these challenges. First, pay transparency. This is really about providing clinicians clear visibility into pay prior to applying. Now, we know employers have been very hesitant to publicly share pay. However, we believe the benefits that come with pay transparency will far outweigh those concerns. We'll talk about how 2 different health systems, one with lower wages and the other one with higher wages, were both able to successfully utilize this strategy. Next, we'll talk about better leveraging social media. Adoption of social media among the clinicians has grown pretty significantly over the last few years. So it is important that health systems recruitment makes an imprint in the same place where these conversations are happening. We'll share our perspective on how health systems can gain traction by deploying this strategy effectively. Finally, we'll talk about the need to focus on mobile friendly recruitment tactics. The convenience of a mobile app and texting can help move the hiring process along much more quickly than typical phone tags and emails. With that, let's jump into pay transparency. We already have a nursing shortage. It is about to get even more challenging going forward. Nurses are getting slammed with options in this environment. What they really need to decide if there's a benefit to participating in the process very early on. It's therefore very important for employers to be proactive and control the narrative. Very clear early pay visibility combined with positioning of other benefits can help them stand out and bring significant traction among clinicians. Employee morale. As Ariel talked a bit earlier, in the current environment, trust among clinicians is broken. Pay transparency is the first step to restoring that trust and giving clinicians the opportunity to trust you back. This is critical both for boosting health systems recruitment as well as retention efforts. Finally, the changes in state regulations. Regulation in few states are already requiring more transparency around pay. States of Colorado and California have already enacted legislations to that effect, and few others are in process. We believe this trend will continue going forward as well. Now, let's walk through how the health systems are successfully deploying pay transparency. First, a 22 facility health system in Midwest that has above average wages. However, prior to providing pay visibility, they struggled with meeting their needs. They had a number of open positions in both nursing and allied health modalities. They struggled with the lead flow and had to spend big money on perm placement agencies. Recruiters were spending most of their time trying to source candidates and very limited time actually engaging with them. Overall, very frustrating for the business units. And so this health system decided to provide pay transparency in their jobs. They displayed their pay as a range from min to max for each job. Within only 2 to 3 weeks of posting pay ranges, the application volume jumped by close to around 30%. Recruiters were now spending much more time screening and moving candidates through the process, thereby improving satisfaction among all the key stakeholders. Gone were the days where they had to struggle with their lead flow. The lead flow was now looking pretty robust. The number of hires improved quite a bit as well, and the time to hire reduced pretty significantly. The 6 days that you see here is not a typo. They were actually able to hire a few nurses in as little time as 6 days. So the strategy turned out to be very successful for this health system. Next, let's review a nationally renowned teaching hospital in Southeast. They had average to below average wages, but historically depended on their reputation to attract staff. They struggled with filling the needs. The lead flow was okay, but many of the candidates ended up dropping out prior to hiring manager interviews. Overall, a disappointing experience for recruiters, candidates, and the hiring managers. Now, this health system was initially very skeptical about sharing the pay. They feared low pay rates will further reduce the application flow. Once they were persuaded to try the new strategy, they started with posting pay as a minimum or start with minimum pay. And also emphasized, along with that, significant benefits that they had to offer, which were beyond pay. These included health benefits on day one, a high sign on bonus, opportunity to work alongside top clinicians in the country, stellar reputation, etc. It turns out their application volume actually increased instead of reducing as they had feared. They also had a number of candidates apply from other states. Overall, the intent of the candidates seemed much higher than before. No surprises then, the number of scheduled interviews jumped up by almost 20%. Higher interviews and better fit resulted in increase in the number of hires as well. The time to hire went down pretty considerably. So you can see through both these examples of health systems on opposite end of the spectrum, one with high wages and the other one with relatively lower wages, how pay visibility strategy works in different pay environments. We actually also see some union hospitals who were initially wary of trying this for fear of upsetting the union embrace this solution as it provided the candidates with clear guidance and better connect. The way they went about doing that was slightly different. In some instances, they would publicize the range, not necessarily coming directly from them, but something which was more of an estimate. But the concept was still there. They wanted to go along the pay transparency strategy. Based on these, we would strongly recommend health systems embrace pay transparency and develop stronger partnership with their candidates and potential employees. This trust and understanding will not only help during recruitment, but also provide significant returns through longer term retention. Our next radical recruitment strategy is leveraging social media. A 2020 survey found 87% of the clinicians are on social media and are spending more than 60 minutes a day on that medium. In the current COVID environment, though, with less in person interaction, we believe the adoption of social media has gone up even higher. So, no surprises then that Facebook ads are used by 70% of the marketers across verticals. Social media has an unparalleled ability to target specific audiences, and therein lies the reason for its popularity. Unfortunately, with all those benefits, only 13% of the health systems reported using social media for recruitment. This to us points to a significant opportunity to boost their recruitment efforts if they can just embrace social media. So, how best to go about utilizing social media in your recruitment efforts? It's not just about being on social media, but really doing it the right way that provides the requisite returns. The few healthcare employers that are actually using social media are still in their infancy. Social media is really an emotional medium and provides maximum benefit once an emotional connect is established between the employer and the clinician. As a result, few things are extremely critical as health systems decide to go and pursue recruitment around social media. One, sharing great stories that come from your organization and provides a peek into your culture. Engaging with online communities in upbeat and helpful ways. And finally, the better health systems can connect with the candidates and communicate the value proposition, the higher is the chance for success by adopting this strategy. Ultimately, the candidates are wanting a more clear, better insight into who are you, what's your value system, what do you offer, and more clearly those things are communicated along with an emotional appeal, the better the chances for success. One of the most significant benefits of advertising on social media is that it offers advanced targeting tools based on location, interests, and job titles to hone in on the right audience. Which other media can offer advantages like that? Social media also provides results driven advertising. So you're paying only for success. Now, the success might come in the form of clicks, views, placements. So there are clearly huge benefits from being on social media. However, it does require consistent testing. Creating and dropping an ad just does not work here. What you need is daily iteration of ad creative with distinct media, clear value add, and a call to action is critical. Social media also provides an algorithmic control. Based on the level of success, you can decide which advertising channel to utilize and also enable them to optimize how they serve the ads. The benefits that social media offers are completely unparalleled. All these are possible, but require constant efforts and also the right expertise. If the health system invests their efforts into social media the way we are just talking about, they'll see huge success from utilizing social media. Finally, let's discuss the impact of mobile devices and advanced technologies to support recruitment. By next year, we'll have almost all the clinicians carry a mobile device. Plus, they're spending almost twice as much time on mobile as they are on their laptops. Clinicians use their phones already to search for jobs, and therefore, mobile strategy has to be front and center of all recruitment efforts. Now, being mobile friendly can substantially improve your candidate experience. One of the biggest benefits of mobile is the ability to have conversations at your convenience, when and where it suits the busy life of your clinicians. Mobiles also provides for instant responses. We know the chance of booking an interview increases to 80% when a recruiter responds within 3 hours. And that makes it pretty compelling for the recruiters to be utilizing the mobile for their recruitment efforts. Now, mobile search also connects across generations. In fact, we are talking about millennials, Gen Xers, or baby boomers. Each age group does most of its searching on mobile devices. Now, millennials may be the most active on mobile. However, in recent years, baby boomers have seen the highest increase in mobile job search among the three generations. Mobile platforms are also equipped with innovative technologies that can connect you more effectively as an employer to the clinicians. Utilization of these advanced technologies that leverage artificial intelligence and machine learning can reduce noise in a pretty significant manner by intelligently matching jobs to the right candidates so that applicants are more likely to be qualified. At times, searching for a job could be like searching for a needle in the haystack, especially with so many different opportunities. Honing in onto the right job is huge. And this is true both from a recruiter as well as the candidate experience. So that ability to reduce the noise, match candidates and jobs with respect to relevance is pretty significant. And it helps, as I said earlier, both the candidates and the recruiters. The productivity gains for both of them is pretty substantive. In fact, 96% of the recruiters believe AI can help boost healthcare recruitment and would really like that opportunity. We know candidates believe exactly the same. So now it's just a function of health systems adopting these strategies in a more comprehensive manner and taking it to market. So, what mobile tactics can we utilize to really deploy mobile in the right way? Mobile apps. Even though it sounds obvious at times, mobile apps are even better than using a mobile web. They build in reminders, notifications, and other strong features that increase candidate responsiveness pretty dramatically. Nearly 90% of the mobile internet time is actually spent in apps. Mobile apps also allow recruiters to tap into social media and cross platform analytics. Mobile recruiting and social media apps, once paired with artificial intelligence, can provide recruiters massive amount of useful data to use when prospecting candidates. Texting. We have all seen the benefits of texting. Advances in texting and an SMS notification means you can carry on conversations with candidates at a time and a location of their choosing. Texting provides for more than 50 times better response rates than emails. All of that means a far more richer experience for the candidates. than they receive when going to a job board, and then wait for a recruiter to reach out to schedule an interview. Chatbots. Chatbots are auto messages, but they feel like coming from humans. Chatbots ensure candidates get a quick reply and feel engaged. Already, chatbots are getting used more and more, but we believe they can handle even more complex scenarios when implemented properly. They're currently projected to handle almost 75 to 90% of the healthcare queries by 2022. So, significant adoption. Overall, health systems have a tremendous opportunity to leverage mobile and related advanced technologies to better engage with the candidates. It should not be the case of few health systems identifying the need. We believe it's time that majority of the health system go ahead and deploy these strategies. So to conclude, we have shared how these three strategies, pay transparency, social media outreach, and a focus on mobile experiences, can provide health systems a defining competitive advantage and better equip them to face the unprecedented challenges coming their way. We are in a time of immense change for the healthcare workforce. There'll be winners and there'll be losers when it comes to recruitment. However, given that core staff recruitment plays such a crucial role in helping systems reduce their reliance on premium labor, success in recruitment efforts today will result in a domino effect of success or failure at a system level few years from now. We believe the time to implement these radical recruitment solutions is really now. We hope you found the content of the webinar useful. Thank you for your time, and please reach out to us if you have any additional questions or comments. We look forward to hearing from you. Thank you.